Oh, Jesus, I have you now. I've been searching for you all my life. What? The information. The information on what? The information on Klinefelter syndrome. What? What are you saying? Yes, you've found it. The pot of gold. That's it, my people now. We've got a mixture of Ireland and England. Ireland and England. Ireland and England. This is my first CD I've done there now. The package. Arr, yes, me Marty's. Oh, japers. Oh, yes, no. Yes. All the languages there now, look. Grazie. Merci. Danke. Shia. Anyway, Klinefelter syndrome. You've come to hear about it all, is it? Alright.
Klinefelter syndrome, 47xxy or XXY syndrome, is a condition caused by chromosome aneuploidy. Affected males have an extra X sex chromosome. The principal effect is abnormal testicular development and reduced fertility. A variety of other physical and behavioural differences and problems are common, though severity varies, and many boys and men with the condition have little detectable effect. It is the second most common extra chromosome condition and is named after Dr. Harry Klinefelter. There's also an XXY Klinefelter's Awareness Week from March 18th to the 24th every year. The first year we had was this year, 2007. The signs and symptoms for XXYs. Well, we're almost always effectively sterile, although advanced reproductive assistance is sometimes possible, and some degree of language learning impairment may be present. In adults, possible characteristics vary widely and include little to no signs of affectedness. A lanky, youthful build and facial appearance, or a rounded body type with some degree of gynecomastia, that's increased breast tissue, that can be seen, but most, only about 10% of XXY males need required surgery. There's also possibilities of breast cancer and osteoporosis. I have osteopenia in my neck, and things like pulmonary disease, varicose veins, diabetes, and rheumatoid arthritis. But patients will be found to have a low serum testosterone level but a high serum follicle stimulating hormone, FSH, and luteinizing hormone, that is LH. There are many variances within the XXY population, just as in the most common 46XY population. While it is possible to characterize 47XXY males with certain body types, that in itself should not be the method of identification as to whether someone has 47XXY or not. The only reliable method of identification is karyotype testing. I'm not going to explain the cause. Personally, I'm not interested in the cause. I'm interested in the treatment and the dealings with people who are XXY. So, the genetic variation is irreversible to this day in 2007. We hope for a better future. But its symptoms can be altered or treated in a number of ways, including testosterone treatment and other therapies, which is estrogen treatment either, and other things as well. While the gender identity of people with the XXY karyotype is generally stable, it seems people with Klinefelter suffer from gender identity disorder. And just to add to this point, also people of the world suffer from gender identity. Knowing what somebody is, they keep thinking that I'm a male, and they keep thinking that my girlfriend's a female, and actually we're all generally, we've got characteristics of each other. Males have of females and females have of males in this day and age. Anyway, so I would totally disagree with gender identity disorder, especially with the disorder point. Anyway, this observation is based on the reports of support groups for transgender and transsexual people, and I can imagine cross-dressing people too. No scientific study on this subject has been done, The fact that a person undergoing treatment for gender identity disorder has Klinefelter syndrome is often missed, or the patient is not told. Although in many jurisdictions, this additional diagnosis can have legal consequences, for example regarding name change or medical treatment having to be taken. Inadequately treated hypogonadism in Klinefelter syndrome increases recognized psychosocial morbidity. At least one study indicates that planned and timed support should be provided for young men with Klinefelter syndrome to ameliorate current poor psychosocial outcomes. Alternatives to testosterone treatment include a daily regime of cardiovascular exercise, along with a complete soy diet or regular vitamins, herbs. Weight-bearing exercise creates muscles and helps osteoporosis and strengthening the bones. The 48 XXYY male syndrome occurs 1 in 17,000 births, they say, and has traditionally been considered to be a variation of Klinefelter syndrome, the evolution of humankind, people. XXYY is no longer generally considered a variation of KS, although it has not been yet assigned on ICD-9 code, whatever alien language that is. Great, these people must feel wonderful. Males with Klinefelter syndrome might have a mosaic 47XXY stroke 46XY constitutional karyotype and varying degrees of spermatogenic failure. Mosaicism 47XXY stroke 46XX with clinical features suggestive of Klinefelter syndrome is very rare. Thus far, only about 10 cases have been described in literature, and I'd say about 1 million people are scared out of their minds to go to anybody and discuss that they think that they've got any of those 47XXY stroke 46XX or 47XXY stroke 46XY or the other ones, the 48XXYY. You know, if you're going to describe them as being assigned to an ICD-9 code, do you think anybody wants to say that in the bar? Hey man, you want a drink? Yeah, what are you? Oh, I'm from the, I've been assigned to ISD-9 code. What the hell does that mean? You know? I mean, this is why people have problems with calling themselves intersex as an XXY or any of those other ones that have been mentioned. Simply, intersex means middle of the sexes. It means that XY is male, XX is female, and I'm XXY. Therefore, I'm not male, and I'm not female. Excuse me, I must go. There's somebody on the other line. But that's a bit of Klinefelter's awareness there, of other people's descriptions of Klinefelter syndrome. They're not my descriptions. I'm just reading what the facts are out there in the world, and then I'm going to give you my facts on what I think Klinefelter syndrome is. After being a year on a forum site talking with other XXYs. So, hope you are interested in my albums. Yeah, this was recycled paper here, and the CD is in here, basically. It's in there. Then you've got the lyrics on the other side in there. So that's the kind of design of it there. Yeah, you close it off like so, and it's the package where everything's wrapped in plastic, except for my CD. Or if you're not environmental, then you can just have it the other way around. It's just the package. It's the pot of gold, really.
Ah, Jim, it is the pot of gold. I hope you found what you were looking for. Well, I still haven't found the doctor I'm looking for. Arr, yar, yar.